Yes, first, we want to congratulate you for emerging the chairman. We learned that in June, that's when the emerged the chairman of this noble association. And for that reason, in respect of the conference that is coming on, and that is why we are here. And I want to first ask you, how will you describe the association that is MDCAN-UDUTH's mission within UDUTH itself and also within the generality of our Sokoto and metropolis? What is your mission? How will you describe your mission as an association? First, you start with your name.
Yeah, well, my name is Dr Nuradeen Aliyu Altine, a consultant orthopedic and trauma surgeon in the Department of Orthopedics and Trauma, Usman Danfodio University Teaching Hospital, Sokoto. I had been elected not long ago in June 2025 as the chairman MDCAN, that is Medical and Dental Consultant Association, UDUTH Sokoto branch. The Medical and Dental Consultant Association, as the name indicates, it is an association comprising specialists, consultants in various fields of medicine and surgical practices in Usman Danfodio University Teaching Hospital. They are the most senior cadre in the medical profession. They serve to treat and manage patients in their respective fields and also offer teaching services to our various trainees who will eventually become consultants. They also do research. All the medical research you have been seeing is contributed by our members in almost more than 90% of cases. We shoulder our responsibilities on the welfare and well-being of the association. We always promote the services of the medical practice. We ensure that it is practiced according to the ethics, and we abide by the law and regulations guiding the hospital services in terms of managing patients and also training our various medical doctors. We partner closely with the hospital management to ensure that there is sanity and proper regulations of our association. It is not worthy to know that the Medical and Dental Association, our consultant association, is an arm of NMA, which is Nigerian Medical Association, which constitute the umbrella of all the other medical doctors with their respective association, including Association of Resident Doctors and Association of Medical Specialists, which are academics in nature, offering teaching and research and the side of PhD, among others. So this is what I have.
Now let's talk about the conference. From findings, we found out that this is the 19th edition of the conference, and it will be holding here in Sokoto. From a fellow's viewpoint, what made this congress important? I mean, what made it indispensable? Can you just...
Well, the conference holding is exclusively under the National Postgraduate Medical College of Nigeria. This college is the main area or body that deals with postgraduate medical educations in the country. We have the equivalent, which is the West African College of Medicine and Surgeons. However, the National Postgraduate Medical College is an exclusive Nigerian body that gives training and also regulates medical education and practice. The usual pattern is the college holds an annual conference event. This annual conference event is called ASCAF, which is an annual scientific conference and all fellows. It's offers an opportunity where all the members of this medical college, all the fellows who have already graduated and practicing as consultant under the National Postgraduate Medical College, comes together and relate with one another in terms of sharing knowledge, researches, education, and medical practice. Aside from the scientific association, there is also social association, networking, where all the members from various regions in the country and even beyond, because we have international fellows, we have fellows that practice outside the country, outside the continent, and even beyond. So this gives an opportunity for them to come together, share knowledge in terms of scientific presentations, workshops, among others. They also discuss issues which prevails the current situation in the medical practice, especially with the economic situation and also the death of practicing doctors. There is currently there is serious shortage in various hospitals where doctors are not found plenty because there is difficulty in giving adequate care to our patients, because most of these medical doctors migrate to other countries in search of a better practicing environment as well as better income. So the conference here give an opportunity to discuss things like this, issues that is that are ravaging the medical practice, so as to pave a way in which the medical practice can be salvaged in terms of producing more doctors, in terms of making sure that the doctors present are retained as much as possible. So this cannot be done without collaborating with the government, collaborating with the Ministry of Health under the leadership of the coordinating Minister of Health and Social Welfare, as well as other stakeholders that are important in saving the current condition. So we must salute the courage and effort of the National Postgraduate Medical College in organizing this conference, which gives an opportunity to hold this conference in northern region, particularly in Sokoto State for the first time. This does not come just by chance. There's an effort made by our mentors and teachers who are practicing here, and they have been part and parcel of National Postgraduate Medical College for a long time. So with that, they are able to convince the college that such important conference can be held here, where opportunity will be given to our practicing area, and they are trying all their best through the local organizing committee to ensure that the members enjoy the conference and it will be a hitch-free event. So this is...
Yep. Thank you very much. We are going to come back to the issue of the migration of our doctors to other places, the term greener pasture. But before then, you said senior colleagues and other mentors actually were able to convince the college to host it here. So I want to say it's really happened here in the northern part, particularly far north, like the far northwest, like Sokoto, Kebbi, and Far. We're having it here now this time around. What are going to be the takeaway, the hopes, the strengths, and what do you think can convince the college to continue to bring such a conference here, owing to the fact that there are tremendous benefits when you host it, because it will open up uh, other areas of knowledge to people who are not familiar with this place.
Yes. Being it a postgraduate medical college of Nigeria, as the name implies, it means there's every opportunity for the college, to hold and host this important event anywhere in the country, particularly a place where they know that there has been a record of medical practice success, and also the resources available in terms of personnel, the infrastructure, and the service delivery that is being recorded over a long time. So it's not surprising that this important event is being held in Sokoto, going back to the history that the Sokoto has in terms of healthcare service delivery, because all the catchment area, Sokoto, Zamfara, Niger, Katsina, all belong to Sokoto axis. So the event give an opportunity for an eye-opening by our teaming members to come and witness what Sokoto is all about and what we have available, and the readiness we tried for a long time to make a good preparation. Because when you look at it, right from the organizing time up to this time, there has been an upload from our members, going by how they see the organization is being executed. So hopefully our members will enjoy the conference and they will have a pleasant experience. And we are ready to make sure that all the needed, things and services will be made available. We collaborate with all the stakeholders to make sure that we have a hitch-free event.
But in the past, resolutions and outcomes of this conference have influenced a government policy. Notably, we know about the National Health Insurance Authority law. This time around, what areas of policy gap that fellows are looking up to see probably the outcome of this conference we address, and also help government to come up with policy that will cover up that lapses they might be observing?
Well, there are many areas, as I've mentioned, of gap that need to be looked into in terms of healthcare service delivery. So the National Health Insurance Authority is just one side of the numerous problems affecting the healthcare delivery. However, with the current government and under the leadership of the current minister with his associates, there has been an effort to further strengthen this, various projects relating to the health, especially the NHIA, which has been reformed, and the new law that is being put is going to help in assisting more efficiency in terms of healthcare financing. We know that NHIA does not cover every medical service, but majority of it have been covered, except for a few ones that are still under review. And we are making all the effort to ensure that things are going to be well. So the relevance of National Postgraduate Medical College and its members is to make sure that pressure is being put to the federal government in all ramifications for the healthcare delivery to be more efficient and effective, especially the healthcare financing. Because without proper financing, the efficiency is not guaranteed, especially in terms of, robust salary payment for the various health workers, and also financing the hospitals in terms of infrastructure, equipment, and other high-tech, buildings, so as to bring the latest, uh, you know, medical management, medical and surgical management.
Well, earlier you talked about migration, talked about brain drain, which is a major challenge in this country, where young persons, particularly in the medical field, are leaving the country to other places they term greener pasture. At this conference, how do you think this conference can help to serve as a mentorship or retention and mentorship tool for residents, particularly from consult to encourage younger consultants to stay back and work to the benefit of Nigerian people?
Yes, the issue of migration has been on, especially in the last 5 to 7 years, due to some economic, derangement that has affected the country. So the healthcare personnel are not excluded on the effect of this economic downturn. That's why the healthcare system, in form of various hospitals, are affected. Because when you look at it, in many departments, there has been search for more medical doctors. Even the training, the medical doctors have reduced drastically. So this is because of all this massive exodus of medical doctors going out. So the association, the MDCAN Association, the National Postgraduate Medical College, the Nigerian Medical Association, and other important stakeholders all put hands on deck to collaborate with federal government to ensure that these trends, these unwanted trends of migration, is being cut off, because it's becoming serious. The conference gives an opportunity for more presentation, because part of the topic is, dealing with this migration issue by the doctors. So there is going to be, research-based presentation based on figures and facts, with the number of the migrated doctors and the consequences, including the inefficiency witnessed in various departments of the hospitals across the country. So the main issue here is for the federal government to make a sacrifice, increase budgetary allocations, and also commit itself in implementing such budgets, increasing remuneration of medical staff, funding for purchase of relevant equipment to improve the working conditions, which is directly, related to the retention of our medical staff, because it forms a full factor for our medical staff to hang around and continue giving their best in terms of healthcare service delivery.
Well, from our conversation so far, I understand that this conference is a very, very important aspect of our general healthcare development and management in Nigeria. In most cases, you see conferences happen and go, probably maybe after the community and people forget about what is done. How important? How do you see the importance of having many documentaries, maybe dedicated photo book to serve as a reminder or something? What can be consulted in the future for the younger generation to have impact? Will you encourage such having this kind of conferences packed in packaging for media, maybe as mini documentary that can serve as what you can consult in the near future?
Advancement in the use of internet has revolutionized the way the communication has been going on. So any conference, for it to be widely, communicated to reach various places far and wide, there has to be involvement with the social media. So the coverage is as important as holding the conference itself, because conference that has not been well covered and communicated across the various stakeholders will not yield much result. So the relevance of having put all the conference activities and package it, and also put it on the social media handle is vital. Its importance cannot be overemphasized, and that is why in ASCAF we employ the most important and relevant social media company, so as to cover it from the beginning to the end, not leaving a bit of it for our members to benefit even after the conference, and also for the general society to see the impact and implement what has been advocated, especially in terms of the need for the progress and development of the healthcare sector. Through these conferences, all the grievances related to the healthcare services are going to be addressed. And it is only through this that the government, will be more focused and serious about it. Because what we want is not involve any high-end decision, especially strike actions. So with the conference, the highlight on the needs for the necessary interventions are going to be addressed and packaged well, so that if there is any need for proper networking, including, diplomacy, sitting down and discuss extensively, and deliberation through diplomacy will be the best way to deal with these issues, so as to, bypass and obviate any need for things like strike or anything related to that.
This is very, very important. This is why Caliphate lenses are really positioned to ensure they provide this. And they are also worried, Caliphate lens is worried that wanted to know that for legacy and mentorship purposes, imagine a young maybe doctor living through this lab, taking through this photo book that will happen this 2025 in 10 years to come. What inspiration, or what do you hope to for the large young person to see in the next 10 years from what our fellow has put together in this a photo book and also a mini documentary for this program?
Yes. So as I have said, the rise in the internet revolution, there is always need to go parallel to the advancement, especially with this digital age, because anything you do now can easily be stored and displayed very well for our, various consumption, by the society. So I don't know whether this is the first time, but at least having this photo book in this conference at Caliphate City, by the ASCAF, will make a difference and will show that we are going, hand in hand with the most recent development in terms of media coverage and social media utilizations. So this is, a very good, achievement, and it will go a long way in, reminding our various National Postgraduate Medical College members that yes, the Caliphate City is ready for the event, and they are there to make it a memorable one, even after, the conference has finished.
Well, thank you very much. You have said a lot, but before I call you to close me with closing notes in a word, with one or two words, I want to ask you for a call to action. How will you encourage members of MDCAN-UDUTH members to actively promote ASCAF participation and the photo book before, during, and after the event?
Well, our members, MDCAN members, are the main stakeholders in this ASCAF Caliphate City. The LOC chairman and all the LOC members, almost 90%, belong to MDCAN-UDUTH. We collaborate well. We assist them in various ways in terms of, transport, in terms of, hosting it in our new secretariat, and in terms of, anything you can imagine. So the encouragement of our members to attend is already there because they are the main stakeholders. They have, invited all the dignitaries that need to be around. Even before the preparation begins, we have made a pilot study, and while preparing, important visitation have been made by the elders of the association and also other members. The Sokoto state government have welcomed the ASCAF members because the National Postgraduate Medical College was able to visit the Sokoto state governor and all the important stakeholders, including Sultan. And there has been assurance of, assistance and collaborations. And some of it have already been done and is being done. And they promise to be there for the ASCAF and also do all the necessary, collaborations that is required. The photo book, I can tell you that it will be a near perfect one, if not perfect, because all members will be captured. Activities will also be there. It will portray the scene and side of the Sokoto State ASCAF Caliphate City event that holds, 2025.
Thank you very much. Maybe in a way of closing, just one or two words to our members regarding maybe for the as we prepare for the conference on Monday.
For the members?
Yeah, just one or two words, just like a closing. Yes.
Yeah. Well, we are thankful to God that we have reached this level of preparation, and it's just few days away from the conference, and everything looks set. So I want to assure the members that the ASCAF Caliphate City 2025 promise to be a good one, and the expected, knowledge transmission, socialization, and advocacy for improvement in healthcare delivery in Nigeria will all be conducted, by God's grace. And we hope it will be successful, and safety of our members will be, a priority. And I wish all, a safe trip
Thank you.
back home. Thank you.
Thank you very much.